Hello and welcome to Devereux's Fireside Chat video series. My name is Amy Ashman. I am Devereux's National Director of Communications. In today's Fireside Chat, we're touching base with three senior leaders to discuss our efforts to attain the Praesidium accreditation, along with what that means for the individuals and families we serve every day, our organization, and very importantly, our staff. I'd like to welcome the following Devereux leaders. President and CEO Carl Clark, Senior Vice President and Chief Operations Officer Dr. Ria Fernandez, and Senior Vice President and Chief Safety and Risk Officer Kelsey Lawson. Thank you all for being here today with us.
Great to be
Glad to be here.
Thank you, Amy.
All right, so I want to give our viewers a little bit of background. As part of Devereux's commitment to provide the safest and highest quality programs and services for the individuals in our care, we are pursuing accreditation with Praesidium, a global leader in abuse risk management. And Kelsey, I'm going to start with you. You're leading the charge with Praesidium. What is this accreditation all about, and why do we as an organization feel the need to attain this accreditation?
Praesidium is an organization. They work globally with organizations to really implement best practices for sexual abuse prevention in general. They work with a variety of organizations that serve youth and vulnerable adults. That can include schools, healthcare providers, human service agencies, religious institutions. Working with Praesidium towards that accreditation is really a way for an organization to demonstrate publicly its commitment to that strategic abuse prevention. So for Devereux, what that means is that it's the next step to build upon all the quality and safety initiatives that we have put in place over the last few years to, again, really be able to demonstrate that systems-based and evidence-based approach to abuse prevention.
Thanks so much, Kelsey. Carl, we've been putting into place several safety and quality efforts over the last several years, and I was wondering if you could tell us, how does this accreditation just further strengthen our efforts in the area of safety and quality?
Right, we've built a very strong foundation, but safety and quality is something that you're always advancing, always in pursuit of. You never arrived at the destination, you continue to pursue it. And both the add of Kelsey to the C-suite as Chief Safety and Risk Officer and the accreditation process with the Praesidium is incredibly important to us because it brings that third-party validation that's very important to have for an organization of our size. Have somebody from the outside looking in and affirming what you're doing in terms of safety and quality.
Excellent. Thank you, Carl. Kelsey, I wanted to ask you a little bit more about the accreditation itself. So would you be able to give a little bit more detail about what's included in the accreditation standards?
Absolutely. So the accreditation standards are organized into 8 core areas that focus on different aspects of your operations to help prevent abuse. So it is everything from our policies to how we screen and hire our employees to how we train and then continue to monitor them, as well as how we respond to any allegation of abuse inside the organization to make sure that we are protecting the individuals in our care.
Also, I want to add that building off what Kelsey said, we are a large organization with many different locations in so many different states, and we're growing. And as we look towards that growth and sustaining consistent operations and practices across this pretty large footprint and diverse footprint, these accreditation standards in these 8 core areas give us a way to codify all of these best practices, make sure that they're being applied in a consistent way across the entire organization, and monitor ourselves with accountability on a go-forward basis against those standards to maintain that consistency.
Kelsey, I want to follow up with you because abuse prevention policies, along with monitoring and setting supervision expectations, are really just the beginning of this process. Tell us what your teams have been working toward when it comes to training and coaching for our staff.
Sure. So the National Quality Improvement Team has been working weekly with center quality directors and operational leaders at the center to really walk through all those accreditation standards and understand what it's going to take to get through the accreditation process. The Praesidium model is really based on creating safe environments, being able to monitor and supervise the individuals that we care for and supervise our teams in a way that really lends itself to that ongoing safe environment. So Amy, you referenced policy changes and training changes. We have been making many changes to many of the good policies that we already have in place to really incorporate that proactive, preventive Praesidium approach. So that's really what teams are working on right now across the organization. Operational teams, clinical teams, our education teams are really working on getting that training out to all of our staff and then really working towards that systematic monitoring and supervision approach.
Thanks, Kelsey. And I understand that we are working toward an accreditation date of July 2023, which is really exciting. Lots of work to be done. Rhea, I want to direct this question to you. Along with making policy adjustments and setting new expectations for monitoring activities that may present higher risk for abuse, I know there are several detailed actions that our campuses and team members are taking now or need to take over the next several months. I was wondering if you could talk about what some of those action steps are and what still needs to occur.
That's exactly right, Amy. There's a lot of focused effort right now by a number of people, all of our teams in preparation for this accreditation. So as you know, we've already done a tremendous amount of work in this area that we can be very proud of over the years. And so now it's time for our teams to start linking all of that effort and work in detail to the Praesidium standards. And so what we're doing on a daily basis is crosswalking all those policies and procedures that have been put in place over years, trainings, facility assessment processes, staff screening standards, supervision standards, and numerous program components that are being compared against the accreditation standards. And so these areas, as you can imagine, they span so many different operational areas and departments. And so colleagues across all these domains are working very diligently towards getting a positive outcome. Notably, we have 40 guardians across the organization who are staff who are typically from our operations or our quality improvement departments in our centers, who have undergone a pretty extensive certification process to become guardians. And as part of their certification, they each had to do a stretch assignment. And so they or an impact project. And so they have already added value to the organization by completing those impact projects. And they are on the ground providing expertise and leadership for this project to be successful. And the way we're looking at it is, this is not a once and done accreditation. This is an investment in sustaining these standards for years to come, and not just towards just achieving one-time accreditation.
Excellent. Thank you so much, Rhea. And I want to follow up with you on this. Would you say it's an accurate statement that it really does require a significant partnership between operations and quality improvement? And if so, how are you working together on that regular basis?
Absolutely, 100%. The partnership between our teams is so critical to a successful outcome, but not just the outcome of accreditation. It's also important for how smoothly and supportively the process goes, right? Anytime you implement a large-scale project, there's got to be a lot of careful thought towards how it's implemented and how our operations can be supported to achieve it, so that they can focus on the quality of the work that they have to do on a day-to-day basis, which is the number one priority, is taking care of clients and our individuals. And so Kelsey's team has been absolutely wonderful. They've created readiness tools for us. They have done a lot of the upfront work to lift that off the centers to support operations. They're on the ground walking our facilities with our teams, making sure that that crosswalk is occurring well. It's not a top-down approach. It's very collaborative. And I think that Kelsey and Phil and Samantha on the NQI team, they set that tone of collaboration and rolling up their sleeves. And we in operations just really appreciate it.
Thank you, Rhea. The other thing I'll add to that, just on a collaboration basis, is it's been really exciting to see the centers collaborating together. So as we've been meeting, we've had all the centers represented in large organizational calls, and to hear the quality directors and operational leaders from one center sharing a best practice with another center, or asking a question to get an answer for how we can all approve and kind of standardize across centers to adopt those best practices, has been a really great outcome of the entire process as well.
Mhm. I wanted to add on to that, what Ria talked about with 40 Guardians, that's in addition to a significant investment that our board has supported us doing. It's something we all can be very proud of.
Thanks, Carl. And now I'd like to shift gears a bit to really talk about the beneficiaries of this accreditation. Ria, our new strategic plan, which places significant focus on the Devereux Family Standard, puts our families at the center of everything we do. How do you envision this Praesidium accreditation benefiting our families and the individuals in our care?
Yeah, Amy, you're right, absolutely right. The Devereux Family Standard is about quality, safety, and trust. And so this speaks directly to the Devereux Family Standard, because what the Family Standard is about putting ourselves in the shoes of family members who place their loved ones in our care. And above all else, what families want is peace of mind that their loved one is taken care of, and that they trust us to do that. And so achieving the accreditation is just one more way in which to reinforce that trust and peace of mind for our families.
Thank you, Ria. And Carl, I'm going to continue that line of questioning with you. Once we achieve accreditation, or as we work to achieve accreditation, how do you feel this will help our communities?
Well, I think it will improve us as a stronger community member, and to be a more vibrant player in that community where we're embraced, because Devereux will be the kind of programs that you want to be in your neighborhood and you want to be associated with because of that focus on safety and quality.
Great, thank you. Kelsey, our team members are so incredibly busy, but the Praesidium accreditation is clearly one of our organization's highest priorities. So what can our employees do to help or keep the momentum going?
Our team members, Amy, come to work every day being prepared to work really hard to keep the individuals in our care safe. We are doing that every day. So the hope really is that Praesidium is not something new. It's just giving us a new lens, some new vocabulary for how we think about abuse prevention and how we talk about abuse in general. So I think one of the most important things that our team members can do is to talk to their teams, talk to their supervisors about the new content that they're learning and the new education they're getting, because the more we really do talk about that difficult subject of abuse, the more we're able to recognize our role in abuse prevention. So I really think it is just the ability to talk amongst ourselves that's going to further the momentum.
At the culmination of what Kelsey said is really looking forward to the accreditation, achieving that. It puts Devereux in a very small group of behavioral health and intellectual disability providers that have achieved this. So, it's great that we're in that thought leadership mode and industry leading mode. And we're all very excited about that. And to arrive at that place in July is a major commitment that we're all dedicated to make.
Great. And Carl, Kelsey, Ria, I just want to thank you all so much for your time today. And to all those watching, thanks for your time, and stay tuned for the next episode of Carl's Fireside Chat video series. Take care and be well.